So here we're talking knee pain. So the way that a woman's pelvis is designed, it's in a triangular shape, and that can put a lot of increased load on our knees, especially in those women that like to run a lot. We're just not designed to bear that load as well. So sometimes we have some women, pregnancy or not, struggling with knee pain. So a couple things you can do at home. The adductors, which are these inner thigh muscles in through here, they attach on your pubic bone and then down into your medial knee. So one really nice stretch you can do is to take a nice wide stance, almost like a sumo squat, get nice and low. This is also really nice for hips. And you're just gonna rotate out and stretch these inner thigh muscles. Again, this is also great for hip mobility in general, but it'll help with that knee pain because of the insertion point on those adductors. The other thing you can do is get nice and low here. And if you're pregnant, you can add a little wedge pillow or a couple different pillows to prop yourself up. You can even use a weight in front of you to help pull towards. And what you're gonna do is just lean forward, again, stretching in through those adductors, which are then inserted here on that medial knee. So just lean forward, lean into it a little bit, and let that feel nice. Next thing you can do, so for the outer part of the knee, our TFL, tensor fasciae latae muscle, starts up in through here, the fleshy part of the muscle belly. It then turns into your IT band, which inserts down here on the knee. So one thing you can do to stretch this, you can get on something almost like a coffee table or a bed. That side you're gonna stretch is gonna hang low like this. This other knee is gonna go in front to support, and you're just gonna drop into it. This is a really nice way to get a stretch in through that IT band and TFL. Just drop in like that. The other thing you can do that's really easy at home, you could use a foam roller and you can lay on the ground and roll through the band and through there. Or you can use something like this. If you don't have this, a baking roller, literally that you would bake cookies with, would be just as good. Get in through this knee, you're gonna roll up towards your heart, always rolling towards the heart, starting at the base of the knee, coming up in through that whole IT band. You can even get quads in through here because these muscle groups are gonna insert on the base of the knee as well. And just get in there and roll. You can also do the medial knee. If you are pregnant, I don't want you to do this until you're about 38 weeks or so, because this can be a little bit of extra strain on the adductors, but getting in through here with your rolling pin or your roller can also help work on that medial knee pain you might be having. Finally, again, we're gonna focus on all these groups that are inserting on the knee, just to stretch the quads, nice and simple. You can get on a wall to stabilize yourself. Give yourself a nice big stretch in through there, stretching out those quadricep muscles, which are then attaching to the base of the knee. Another way to do this is to sit almost in a pigeon pose. You're gonna sit nice and tall in pigeon. You're gonna reach behind you and grab your knee. This is a bit more intense, but this is a really nice way to stretch that quad muscle on the front end and relieve that knee pain you might be experiencing. Hope you found that helpful.